In this episode, I'm speaking again with Dr. Carlos Escobar, a PhD scientist and the director of a stem cell lab that has produced stem cells for over 10,000 patients. We discuss one of the most misunderstood questions in regenerative medicine: how stem cells actually work. Rather than functioning as replacement parts, we uncover what stem cells really do in the body once they're injected, and why the environment inside the patient's body matters so much. If you're considering stem cell therapy, or you've received stem cell therapy in the past and are curious about why results vary so much, this episode will clear things up. Before we get started, I recommend that you turn on the subtitles that I've created for this episode to help you get the most out of the conversation.
I think this is a good moment to have a little explanation about how the cells work. Back in the 70s, when somebody described for the first time, they thought we can modify the cells and convert it to specialized cells. You can convert them to cartilage. You can convert it to neurons. You can convert it to myocardial cells.
So you're saying in the 70s, they discovered these things called stem cells, and they thought that these stem cells, which are like immature cells, could substitute the damaged cells in the rest of the body.
Exactly.
This next explanation by Carlos of what stem cells do and how they actually work is one of the clearest ways I've ever heard it explained.
However, later on, everybody understood that these cells work, but they don't work substituting the musician on the orchestra. Mm-hmm. They substitute the director of the orchestra. So the main point is these cells work sending signals, sending instruction. The director of the orchestra sends specific instructions to the musicians he keeps on the orchestra.
Okay, so let me see if I understand this. Previously, they thought if you had a damaged musician in the orchestra, then you would use the stem cells to send in a new musician
to substitute the one who left.
And then they realized, no, this is not the case. Mm-hmm. That what the stem cells are doing is actually sending information, like the conductor saying, mm-hmm. do this, mm-hmm. do that, mm-hmm. stop doing this, mm-hmm. start doing this.
Exactly that.
So in that sense, the stem cells are not directly healing the body. They're telling the body mm-hmm. how to heal itself. Is that right?
It could be. I really like an experiment. Somebody took female mouses, right, and make an injury on the skin, and they put male mouse cells. The tissue regenerate, but they couldn't find a cell with an G chromosome. Just female cells. So the cells you transfer help the damaged tissue to recover.
Okay, got it. So what you're explaining is the mechanism of how stem cells heal the body.
Exactly.
Before we move on, I think it's worth reviewing what that mouse experiment actually showed. The stem cells that were injected didn't become part of the mouse's body itself. Rather, they helped the mouse heal by sending signals. They gave its body new instructions about how to repair the damage. That's important because it addresses one of the concerns that many people have about stem cell therapy: the fear that someone else's cells might stay in their body and start multiplying. This experiment shows that stem cell therapy doesn't work that way, and it leads to the next topic that we explore. If the stem cells act more like conductors of an orchestra and your own cells are the musicians, then the condition that those musicians are in is critical. In case you're interested, I've put together a beginner's guide to stem cells and regenerative medicine with all the basics. You can download it at yourstemcellguide.com/PDF, or you can use the direct link in this episode's description. In this next section, Carlos and I explore why a patient's habits and their overall health play such a critical role in whether stem cell therapy actually works.
Right now, we are working with the university, helping medical doctors to understand how you have to prepare the patient before giving him the cells. It's not the same if you have a system where everything is telling all the cells to turn into fat, and if you modify that and you now have an environment telling the cells to turn into cartilage. So you have to prepare the tissue, you have to prepare the patient.
What you're saying is it's not enough just to get stem cells and put them in the body and hope for the best. It's important to prepare the body.
Yeah, let's talk about arthrosis, right? Why you have arthrosis? You have arthrosis because you don't have good habits. And what is that? You smoke, you have overweight, you don't practice any kind of sport, right? And you work until very late on night, right? And that it's why you have arthrosis. So you came to the doctor and you said, okay, I have a pain on my knee, I need to solve this, right? And the medical doctor said, okay, we can use stem cells. And stem cells could help you. But pretty soon you will be again on the same position or even worse, right? So you need to understand if you want to recover your health condition, you need to change your habits. The cells will help you, but you need to change your habits.
So these cells are not like a quick fix.
No.
It's a like a solution, because if you changed your habits and you already have arthrosis in your knee, then you might get a little bit better, but the arthrosis is already there, right? If you change your habits and you apply stem cells, you could regenerate the
And
tissue,
you will keep longer your health.
and you will remain free of arthrosis afterwards.
Exactly. Exactly. That's my message. And it's for everything. I mean, let's think about diabetes, right? Diabetes is a huge problem. We have a lot of great stories about diabetes patients, but always they have to change their habits. If not, the problem will be worse for sure.
Okay. If they just get stem cells, don't change anything else in their life, then the cause that was the reason why they got this condition is still there.
Exactly.
But the stem cells, it's like just putting a blanket on top of a fire instead of like putting the fire out first.
No, I will say that you are putting seeds on wood. You don't have nothing. If you don't have proper terrain to allow the seeding growing, you won't have a good result.
Okay, so the stem cells, that's like an analogy of like seeds. If you plant them in barren soil, that's like on concrete.
Concrete.
Yeah,
Perfect.
or, just no water, no nutrients in the soil.
Exactly.
They can't have the effect that they would have
Exactly.
if you would prepare the terrain, put some water in there, the nutrients, get it all ready for the cells.
Exactly.
Okay, super
And
important.
you have to take care, now on, right? I mean, you put the cells and you take care of them 1 month, and after stop that, you will lose the result.
It makes me think, I heard of a man who had a failed stem cell procedure. And so he came from the United States to Colombia. They gave him, I'm sure, really good stem cells, a very good procedure. But after that, he went to Brazil on a holiday, and he went like for the what do you call it? That big festival they had there.
How's it? Give me a moment. Ay, se me olvidó.
Carnival. Something like
Exactly,
that.
Carnaval.
He went-
Rio Carnaval.
He went to Carnival, and so he was like, "Whoa! I've helped myself. I had some stem cells. Now I'm going to drink and party."
I want to give alcohol to my stem cells. They will like it, right?
So yeah, so stem cells are not a cure all. You need to have an environment in your body that will support them to help you.
Yeah, and I think it's pretty important to say this. First, you need to change your habits, not only to avoid the causes of your problem, and be sure you won't be again at that position. Your habits will kill the cells also. If you smoke, if you have a lot of drink, if you don't eat properly, you will kill your cells, your stem cells. So at the end, everything is bad.
I hope this episode has been valuable for you. Before you go, let's briefly recap on a few key ideas. Firstly, stem cells don't work by replacing your body's damaged or dead cells. Instead, they give your body new instructions on how to heal and rebuild itself. Second, the injected stem cells don't become a permanent part of your body. Third, preparing your body before, during, and after treatment is one of the most important factors in getting good results from stem cell therapy. To help you with that, I've put together a short downloadable PDF outlining practical steps that you can take to get the maximum benefit from stem cells. You can find it at yourstemcellguide.com/PDF. And there's also a direct link to download it in this episode's description. The next episode will explore exosomes, a regenerative therapy that's related to stem cells and why it's attracting so much attention as a possible alternative for some patients. I also invite you to explore the other episodes in this series, where the goal is to help you understand regenerative medicine clearly so that you can take more informed decisions about your health. Thanks for listening, and I'll see you in the next episode.